Good morning. My name is Stephen Williams, the Director of the Houston Health Department, and this is your COVID-19 talk with local health authorities. Dr. David Persse representing the City of Houston and Dr. Umair Shah representing Harris County. We've done about a dozen of these in the last few weeks, but I'll start with the first question. I know we've been asked this before, but by comment from President Kathy Finninger, who is the president of Houston Rotary Club, the sponsor of this, is that people are still asking this. So I'll ask again. Reports from Wuhan and South Korea show that very few people contacted the virus from outside activities, but mostly from inside activities, like speaking, coughing, sneezing. But one area of concern that was uncovered was the pattern of customers who got sick in restaurants. The airflow from conditioners played a major part in contaminating customers downwind from the air duct. If true, how do we warn restaurant customers that the air conditioner system may spread the unseen virus as effective as sitting next to an infected person? Actually, I saw a diagram that illustrated that.
I didn't see that diagram.
You did?
No. Go ahead.
Well, you know, I'll start by saying that we do know that indoor is higher risk. Outdoor, there's a lot of dilution of air and movement of air. But indoor, the real concern that we have is that, one, we're closer to each other, there isn't as much movement of air, and that we know that coughing, I've seen that up to about 3,000 droplets can come out at one cough. And the majority of those droplets will actually sink somewhere, but there are droplets that will stay in the air, and then that's when an air conditioner system could potentially pull it and now blow it elsewhere. You know, these are all risk benefit ratios, and we've got to remember that there is no completely zero risk as it comes to fighting this virus. And so people are taking on some risk as they are going into establishments, and we have to remind ourselves of what David and I have been saying for the last few weeks, which is, look, just because establishments are open, they don't have to be open. I mean, they can certainly look at what they need to do in order to, be comfortable that they're following health protocols. And just because patrons can go to an establishment doesn't mean that they must go to an establishment. I think those are two factors in it. When it comes to the airflow, that's Dr. Persse's expertise.
Oh, it is?
So I'll let him talk about the airflow piece, but from the general, I'll just give those general comments.
Sure, I wasn't familiar with my airflow degree. But I mean, I think it just sort of stands to reason that we know that when people speak, and in a restaurant, of course, you're not wearing masks because you're eating, right? So people tend to, you should as much as possible, but obviously there's going to be times when people are going to be eating and they're not going to be wearing the mask. And we do know that speaking, that does, put particles in the air. And we do know that as, and the question really kind of goes to the air conditioners and the airflow within, and that's going to take it, elsewhere. Now, when I've been in restaurants, I haven't really been checking the wind direction. And it's almost impossible to do it. But this is one of the reasons why when the governor went to 25%, that's, and one of the things that we talked about was, if you're a restaurant owner, you're not going to open up a quarter of your restaurant and leave 75% of it closed. You open up the entire restaurant and you spread people out throughout it, so you've got that distance to minimize this effect. And now we've gone to 50%. And so it's basically the same sort of theory of minimizing, not eliminating the risk.
That's right.
With Houston Fire Department responding to over 500 overcrowding complaints this past weekend, what are your thoughts about this new enforcement job they have, and how they're being kept safe? What is your reaction to the lack of responsiveness to distancing this past weekend at events like a pool party in the Midtown area?
Yeah. So I'll take that one because I work with the fire department. My conversations with firefighters that do that have been that for the most part, business owners have been really good about trying to adhere to the rules and have been very, very cooperative. There have been the one-offs, certainly, and my understanding is that they have yet to issue any citations. They would rather not do that, rather get people to change their behavior and do things. But it sounds like the business owners are trying to comply as much as possible. The patrons, not always so much, and that's when we get into the situation like with the pool party and stuff. And so that's when actually, I believe HPD got called in to help with that large pool party. And to me, this illustrates the conundrum, right? The business owners, they want their business to be up and going again. They want to get the economy going again. But a lot of society just wants to go back to the way things were. And that's the problem, is that we can't go back. We have to go to this new normal and move forward. And as long as we have people trying to continue to go back, I think we're going to continue to have these conflicts.
Yeah, and I think just the only thing I would add is that just we want to make sure that we emphasize that people don't take this virus lightly, and there isn't complacency. Just because it's summer, it's time that kids are off from school, and various things that are happening. We want to make sure that people are not taking this virus lightly, even if a younger individual may not have those serious symptoms and might have just very mild symptoms or no symptoms. They can still carry this virus as a carrier into somebody who can get really significantly sick, your grandmother or your uncle or your aunt, and we want to make sure that we do everything we can to protect those individuals as well.
Okay, when is the third phase scheduled to begin in Texas, and what will that entail? I can only find information up to June 1, and the thought of kids this summer with no place to go safely is very stressful. Camp sounds too iffy right now.
Yeah. Well, so I don't know in the third phase. That's going to be the governor's call, and I've not heard anything about what he's planning yet. I think the question was asked about camps and summer camps, and what the conversations I've had with some of the camp directors, they're looking to minimize the number of folks that are at the camps. They still plan on opening lesser kids, increase the amount of outdoor activities, and they're paying attention. Really, if you're going to a camp and it's an overnight camp, the sleeping arrangements need to be such that we don't have the kids all close together. Again, it's not eliminating. If you want to eliminate the risk, don't send your kid to camp. You want to minimize the risk, make sure the camp is doing all they can to protect your child.
Yeah, absolutely. And it is good that the governor did, even over the Memorial Day weekend, did make some comments about his concerns about people coming together without wearing the facial coverings and without social distancing. And so I'm hopeful that as we get to this next phase, that the governor is going to be taking all that into consideration as he makes his next set of recommendations.
Can I let my children take swim lessons? Doesn't chlorine take care of keeping the pool clean? Why are city pools remaining closed? Amusement parks, how safe are they?
Yeah, so this is a great question. So the problem, this is a really good question. I'm glad somebody asked. The problem is not how much chlorine there is in the pool, because it's chlorinated, and generally pools are a little bit more chlorinated than, say, your drinking water. So there's plenty of chlorine in the pool. The thing is that the chlorine doesn't kill the virus instantaneously, but that's not really the risk factor with pools. The risk factor with pools is that when you're in a pool, especially if you're a kid, there's no social distancing that occurs in the pool. The kids are all hanging out close to each other and stuff, and they get a little bit of water, and then they start coughing and hacking, and that's the risk. And so there's the problem with pools.
And then in addition, just the congregation in the water or outside of the water.
Right.
Okay, you are tuning in to the COVID-19 talk with local health authorities. You'll be right back.
Wash your hands. Scrub them while you sing this song. Wash. Rub your hands and fingers in the places in between. Using soap and water makes your blood so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1.
Taking care of yourself is also taking care of others. We are all in this together.
How does the 2020 census affect representation? There are 435 seats in the House of Representatives. These get distributed to the 50 states by population, and an accurate census response helps your state get the right amount of seats. States with smaller populations get at least one, while states with larger populations might get more. Shape your future. Start here. Visit 2020census.gov.
Welcome back to the COVID-19 Talk with Local Health Authorities. This is sponsored by our Rotary Club of Houston. We have a Facebook question coming in. What is the current recovery rate of the virus? If recovery rate is higher for a specific group set, what is it for the rest?
Yeah. All right, so I'll take a stab at this. I don't think we know what the recovery rate is because we don't know the number of folks who've recovered. And the reason for that is that a lot of people who become ill will recover using, what we call the clinical method, which is that you got to go without fever for 3 days, no other symptoms or improving symptoms, no fever, and then it has to be at least 10 days since they, first had symptoms. That doesn't get recorded anywhere. So that's somebody who would have recovered, but it's not recorded. So it's hard to know. Now, the other part of the question kind of goes to is, one group recovering better than the other, and the flip side of that is we do continue to see that folks who are elder with continuing illness, chronic illnesses, and obesity, those are the ones at highest risk for having complications.
Okay.
Yeah, the other thing I would just add to it is we also don't really know the full denominator of how many people are getting COVID-19 in any community, because the vast majority of people are still asymptomatic or mildly symptomatic, and so they may never even go to a doctor or may never even get tested.
Right.
That's why we want to continue to encourage testing.
Okay. Why do the Marshall Islands with poor health conditions have no cases and Brazil is second only to the U.S. for cases?
Well, honestly, I haven't looked at the Marshall Islands, so I'll have to do a better look at that. But I will say that we are seeing a real diversity across the globe, and it is very complicated to unpack this. In some places, it's really about surveillance systems and public health systems, healthcare systems not being robust enough to pick up the virus. In Brazil, you're having looked like a delay initially on really elected leadership, public health leadership, and they're sort of passing in the night in terms of who thought what should be done. And unfortunately, they've gotten behind the ball now, and unfortunately, that's meant that their system has gotten overrun as well. But I think the key message is that this is really playing out in a very diverse way across the globe, and even across the country, and every state in this country has a different way of doing this, and also, or this is playing out, and it's also the same way across the globe.
I know you've been asked this often, but information seems to change every week. Please discuss the accuracy and explain nucleic acid amplification testing and antibody detection tests.
Okay, I'll take a crack at that. So the nuclear amplification test, it's our PCR, polymerase chain reaction test, where they actually test for the sequence of amino acids that are in the virus. And most of those tests don't look for the entire sequence of the virus, but segments of the virus to see whether or not it's there. And when you get a positive with that, it's highly accurate, right? The only way to get a false positive if there is cross-contamination somewhere in the process, generally before the lab. So if if it's a sterile swab and only one person touches it and puts in things like everybody's doing now, there should be low risk of that.
Okay, I have another question. Go ahead.
Oh, I said, but the other part of the question was the antibody test. And the antibody tests, there's still lots and lots of problems with their accuracy. And so even the CDC just on the 23rd, just a few days ago, came out once again and sort of doubled down on how the antibody tests are really not clinically useful at this point.
Okay, will taking ACE2 inhibitor prevent COVID-19?
Not that I know of. Are you aware of any H2 inhibitor?
No, I mean, I haven't seen anything related to that.
Okay, so the answer is no.
H2
Is it an H2 or an ACE inhibitor?
ACE2. ACE2
Oh,
inhibitor.
Oh, ACE2, ACE,
Okay.
angiotensin converting enzyme. Yeah, so will it prevent it?
Yes.
An inhibitor? No, in fact, the one argument is that it may increase the risk.
That's right.
Because what happens is you take an ACE inhibitor, which is a blood pressure medication, and that blocks the ACE2 receptors on the cells. And so the cells respond by increasing the number of receptors. And that's why sometimes people's doses have to go up with those medications. But it appears to be that's the receptor that the virus likes to attach itself to. So it may actually increase your risk.
Okay. Dr. Mike Ryan of the World Health Organization warns that we're still on the first wave, but we might get a second peak where coronavirus is declining. What are your thoughts about that happening in Houston?
Well, we've had. I mean, you could sort of look at it from a few phases here, right? We've had the initial phase where we were watching, and then we were all of a sudden in a frenzy of activity to diagnose the first set of cases and a lot of flurry of activities. Then we slowed things down by the the stay home orders, and then now we're reopening. And so that is those are a number of phases. And if you look at it, that we are now looking at this reopening as, does that mean there's an additional, we call it the epidemiology, but is there an additional way that this is going to now play out? And we don't know. The point is that what WHO and Dr. Ryan is saying is that initially we've gone through that first wave. Now reopening and reintegration of society across the globe is happening, and that now means that you're going to have a different way this is going to play out. And then, of course, this goes into the fall question that everybody has, is that if there is some decrease in activity over the summer, and we're, again, hopeful there is, does that mean in the fall that it comes back with a vengeance, especially around flu season? And the answer is we don't know.
Okay, a relative of mine needed emergency surgery and had to move to another hospital as they did not have a specialty team because some doctors and nurses were cut to part-time because things were slow. How will we be able to maintain hospital readiness?
Yeah, so this is an important question. So as the hospitals have done a great job of creating capacity in the anticipation of a surge, to some cynics would say that they overestimated, and the hospital census has dropped very, very low. And so hospitals have responded to that by, furloughing some of their staff, including the physicians. And so as hospitals start, the governor has allowed for elective surgery, and hospitals are starting to fill back up again, and that staff theoretically will come back on board, and we'll get back up within a couple weeks to months.
Okay, I am trying so hard not to be paranoid, but should we all have an oximeter at home just in case? If you say yes, I'm not sure which one to get. Are they all about the same?
So I would say you don't need it, and I'll tell you why. A couple of things is, one is you really need to be paying attention to your symptoms and how you're feeling, right? Because, and here's another twist with this virus. Again, it's breaking all the rules. Is we're finding a lot of folks have got these really terrible pulse oximetry readings, and they're breathing just fine, which means that the pulse oximetry is, there's a lot of things that can make your pulse oximetry reading go low, and if you feel totally fine and your number's a little bit low, I don't want people panicking and running off the emergency department. And so I would just go by your symptoms at this point and leave the technology to the professionals.
Yeah, I agree.
We keep hearing that the virus spreads easily indoors. Shouldn't that be a good reason to get out of our houses when at all possible?
Well, I think we have been saying that, we want people to be out and about as they can be, but just to be doing that safely. And doing that safely means that, wearing the facial coverings, social distance, and away from others, and not really getting into situations where you're going to be crowding others. So going to, outdoor activities, going walking in the park or your neighborhood, that's the kind of stuff we do want people to do. I think there's a confusion because when we say outdoor, some people think outdoor means from a house into a business, and that isn't really outdoors, it's just out of the house.
Okay, you have been joining us for the COVID-19 talk with local health authorities. We'll be right back in a minute.
We have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
How do you protect yourself and others from coronavirus?
Avoid touching your eyes, your nose, and your mouth.
Wash your hands often with soap and water for 20+ seconds.
Clean and disinfect surfaces and objects.
Together, we can help slow the spread.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65 or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing the song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers in the places in between. Using soap and water makes your hands so clean. Wash your hands. dance. Great job, you're almost done. 5, 4, 3, 2, 1, now drive.
Wash your hands for 20 seconds, just like Elmo.
Welcome back to our COVID-19 talk with local health authorities, sponsored by the Rotary Club of Houston. We have another question that's coming in through Facebook. So what outdoor activities are safe this summer for young kids? Help, I'm desperate.
What I would say is the outdoor activities are really where you can continue to safely social distance and not mix and get close, and you can still wear the facial coverings. Those are the, and in general, this just writing it through. I'm trying to go quick because I know we have lots of questions.
Yeah. Yeah, I would agree. I mean, it's going to be hard to get kids to keep the mask on, but smaller groups, I would say. Kids playing outside in smaller groups as opposed to big groups probably be the better way to go.
I will be visiting relatives, and on the way, we'll have to stop at public restrooms. What should I bring to sanitize the room before going in? Or do you have to sanitize the room at all?
Yeah, well, so I'm not trusting anybody. So, yeah, I would bring something to you know what surfaces you're going to touch. You may want to, here's a good idea, you may want to wear gloves before you go in, and then take them off as soon as you come out. But the problem with gloves is wearing them for too long. They should be short. We wear gloves, just wear them for a brief period.
And disinfecting wipes.
And disinfecting wipes, yeah.
What do you know? Do you know what Metro is doing to clean buses?
So we worked with Metro. It's been a little while now, but we worked with Metro when they were getting up their plans. And while I can't recite to you what they were, I remember I was pretty impressed with all the things that they were doing. And so again, I wish I could recite to you to answer that question specifically, but I remember we were pretty satisfied and impressed with their plans.
My building has a parking garage. What should tenants expect or ask the landlord to do to keep us safe in elevators, keypads, etc.? No one seems to understand the need to clean frequently.
Well, I think that's going to be a conundrum, right? Because we are going to be relying on these lease companies to be able to do a lot of things. And so whatever they can do to disinfect, whatever they can do to wrap continual cleaning, that's going to be important. But I think it's more important that you don't know what you're touching, so minimize your touching, and also make sure that you're wiping yourself or you're wearing gloves or all the different things that we're trying to do. Make sure you hand wash or you know, the hand sanitizer as you get back to your apartment.
Yeah. One thing that I've started doing is, I know the risk is that you touch something and you touch your face, right?
Yeah.
It's not that touch your hand. So I've started using my elbow. In elevators and doors, I'm trying to use my elbow because I can't touch my face with my elbow. But then my elbow I have to recognize is contaminated.
That's right, yeah.
Novavax phase 1 vaccine clinical trials is starting. What is the fastest this can move ahead?
The fastest it can move ahead? Oh, geez, I don't know. But I know they're moving about as fast as they can. Remember, the phase 1 trial is just to make sure that it's safe.
Okay.
So you give it, and then you got to observe for, you know, it used to be you would observe for like 3-4 months to make sure nobody had any, you know, impact from it. They're shortening those timelines, and they're moving from phase 1 to phase 2 very quickly.
Yeah.
So.
Yeah, the president has said that he's looking for the end of this calendar year. Dr. Fauci and others have said it's going to be at least a year and a half out. So we'll see.
Yeah.
We take temperatures of all employees entering our office. A coworker started to quickly feel poorly later in the day, and it turned out he tested positive for the virus. Is there a better test we can use on a daily basis?
Yeah, this is one of the problems with this virus is that even with the testing for a fever is a good thing to do, but remember, people are infected and they start producing virus and potentially spreading virus even before they get the fever. So it's a good thing that people do that to check the temperature, but quite honestly, this scenario is entirely possible with nobody doing anything wrong.
That's right. But we do want to remind people to also consider temperature checks during the day as well, not just on entry.
A supposed friend said they didn't care what the government recommends. They will go anywhere without a mask, and if people are afraid, they should stay home. Where does my right to be safe begin, and where does his right to infect me end? Isn't willful disregard criminal behavior if he ends up infecting people? That's not necessarily a public health question, is it?
It's a public health law question.
Yeah, it's a public law question. I think where I would just go is that, you know, we do want to make sure that responsible behavior is what we're all doing. And there's so many things that we ask for that to happen when it comes to seatbelts and wearing helmets for, you know, putting helmets on children as they ride bicycles. You know, there's so many things that are really about it's what you want to do to protect yourself, the ones around you, as well as your community. And I don't think we even bat an eye on those. And so, you know, that's where I would leave it.
Another question just came in. Most of the stats are stated in raw numbers. Why do you think these are not stated in terms of percentages of relevant populations, which would make them more comparable?
Yeah. Good question, and I think that the person with the question is right. We do tend to talk about raw numbers. Part of that's because you have to go back and do the calculations, and it gets a little bit more complicated. But there are reports. You and I see reports all the time that are percentages. So that data is available. Maybe it's a good suggestion. Maybe we need to start talking about percentages publicly more often.
Okay. So now people are breaking out and acting from wearing a mask, and it's so common it's named masking. I'm already washing my mask often and keeping my face clean. That's just a statement.
Yeah, it's a problem that, you know, healthcare professionals have had for decades of, you know, when you're in a surgery or you're, you know, wearing some sort of facial covering. I mean, there are some side of, you know, impact of that on your own skin. So do whatever you can to.
Right. But you know, you can't go to a dermatologist. They do have some ways to help with that. So.
What is the connection between COVID-19 and meningitis?
So far, I don't know if there is. Although I will say that this virus will infect any organ system. We've seen that.
But I haven't seen any real research that's out there about meningitis and COVID-19.
Particularly, no, me neither.
But we'll look. Yeah.
Baylor College of Medicine is going to do antibody tests. Are they accurate yet?
Well, so I've been talking with the folks at Baylor, and one of the reasons it's not out yet is because they're going to such great lengths to make sure that when it comes out, it's going to be accurate. Okay. So we need to give them time.
What about the accuracy of current diagnostic tests? We keep hearing about false negatives and positives. Do we know if they work yet?
Well, like I said before, the PCR tests are
pretty good.
Are pretty good. Now, you still can't get false negatives with those, right?
Right.
But it's really hard to get a false positive.
That's right.
Can we safely vote in person? There is so much discussion right now about how all elections should be via mail.
Well, it's the same thing that we've been saying before. It all goes to how dense the polling booths are. So when I went to vote during the primaries, I expected it to be all jammed up. And I got there, and there was one other person in line waiting to vote. So I got lucky. I got in, I voted right away and got out. But I've been there when it's been a long line. So, you know, I think that if you know, in that debate, it all goes back to the physical distancing issue.
Right. Modifications are likely going to be needed in some level.
Right.
Yeah, some degree.
The governor lifted air travel restrictions last week. Are there any travel restrictions for Harris County? Should we be asking visitors from high-risk states to self-quarantine when visiting Texas?
Well, you know, we're not the United States of Harris County. It's a county, and we are part of a state, which is a part of a country, and you know, those restrictions on travel really are not based on the county jurisdiction. It's really based on bigger jurisdictions for a size like a state or a federal. So we don't have that ability really to do that. Number two is that I'm not sure it's really as effective anymore because we have community spread. I mean, this is way back early when you didn't have community spread. Now it's in our community.
Yeah, the other thing is that, remember, nearly a third of the world's cases are here in the United States. So,
right.
France's education minister has said the lack of schooling has increased inequalities and in a social emergency. Thus, they're starting reopening their primary schools. So far, around 1 in 5 have returned, mostly from wealthier families. Your thoughts? That's an equity question.
Yeah, my thoughts are that this, unfortunately, inequities existed well before COVID-19, and unfortunately, COVID-19 has brought some of those out even more so.
And Persse, this is a question for you, and I think it's a very difficult question for you to answer.
Okay.
Bob Seekley wants to know, for humor's sake, is that a COVID tie?
Is this a COVID tie?
That you're wearing?
So this is actually, this is not COVID, this is Streptococcus. This is a Streptococcus tie. And I have a West Nile tie. I don't think they've made the COVID tie just yet, but when it comes out, I will get one. And I want to thank my daughter for getting me this.
Okay. Thank you for watching the COVID-19 Talk with local health authorities. Dr. David Persse, representing the City of Houston. Dr. Umair Shah, representing Harris County. This is sponsored by the Rotary Club of Houston. I want to thank you to President Kathy Finninger, who is responsible for getting these questions from folks and sending us to us, and also texting me. My name is Stephen Williams. I'm the director of the Houston Health Department. We'll see you next week.
Okay.